You have probably heard that being overweight increases your risk for diabetes. But here's the tricky question. Why exactly does that happen? It is just about eating too much sugar, or there is something deeper going on in your body? Let me ask you a question I hear it all the time. The patients come to me and say, I don't eat that badly, why I'm still pre-diabetic? Or I'm just 15 pounds overweight. Does that really matter? Well, the answer is not just about willpower. It's about biology. Let me tell you a quick story that might change how you see this. So I have a patient of mine, 39-year-old male, software engineer, gained about 25 pounds over the last 5 years. He wasn't obese by numbers. His BMI is only 29. Technically overweight. Labs showed slightly high fasting glucose and A1C of 5.9%. That means borderline diabetic. He was shocked. He said to me, but I'm not that heavy. How can I be insulin resistant already? So we dug deeper, and what we found had nothing to do with willpower and everything to do with how fat behaves inside your body. So let's talk about science here. 5 points. Number 1, it is not just fat, it is where and what it does. See, fat is not just storage, it is biologically active. It releases hormones, inflammatory chemicals, and can dysregulate insulin. There is 2 kinds of fat you need to know. Number 1 is subcutaneous fat, under the skin, relatively harmless. Number 2, which is the harmful fat, visceral fat, around your organs, metabolically toxic. This visceral fat increases inflammation, disrupts insulin signaling, and releases free fatty acid that overwhelm your liver and your pancreas. Number 2, here's a tricky question. How obesity leads to insulin resistance? Let's take it step by step. So excess fat, that means overflow of free fatty acid into the bloodstream. This free fatty acid accumulates in muscle and liver, blocks insulin receptors. So body tried to compensate for that by producing more insulin, a phenomenon called hyperinsulinemia. Eventually, beta cells in pancreas which produce insulin burn out, causing type 2 diabetes. So it's not just sugar intake, it's about how your body responds to insulin and how fat sabotages that process. Number 3, the rule of inflammation. Well, obesity, by the book, is a chronic inflammatory state. This fatty tissue releases TNF-alpha, interleukin-6, and other cytokines, all inflammatory chemicals, and this will interfere with insulin receptors. And they also damage blood vessels, raising cardiovascular risk. That's why obesity and diabetes often come with high blood pressure, high triglyceride, and low HDL, the metabolic syndrome cluster, the nightmare. Number 4 is the gut microbiome connection. Well, obesity can alter your gut bacteria, increasing intestinal permeability, causing leaky gut. This leaky gut allows inflammatory molecules enter your bloodstream, worsening insulin resistance. Number 5, which is the last point, genetics, sleep, and hormones. Well, some people store more visceral fat even at lower BMI. That's a genetic talk. What about the sleep? Poor sleep increases ghrelin, which is hunger hormone, and decreases leptin, the fullness signaling. Stress, especially chronic stress, can increase your cortisol level, causing more belly fat and insulin resistance. So let's go back to my patient. So we ordered several things. First of all, fasting insulin, which was elevated. Number 2, HOMAIR, hemostatic model assessment for insulin resistance. The score was high. And also the liver ultrasound showed fatty liver. He wasn't diabetic yet, but his body was on the path. So we worked on him. We increased his muscle mass through resistance training. Number 2, low carb, high protein meals to improve insulin sensitivity. Number 3, intermittent fasting to reduce hepatic fat. And number 4, addressed sleep and stress. In only 6 months, his A1C dropped to 5.4%. He lost 12 pounds and his liver enzymes normalized. He didn't just look better, he reversed early diabetes and added years to his life. Now I see you wondering, who is at risk? When should I take this seriously? Well, number 1, if you have a family history of type 2 diabetes. Number 2, if your waist circumference is more than 40 inches in men and more than 35 inches in women. If your A1C is above 5.6, if you're feeling fatigue after meals or frequent hunger, or you have a belly fat, and lastly, if you have a history of PCOS or gestational diabetes. Diabetes doesn't happen overnight. It builds quietly, and fat is a major part of the story. So here's the bottom line. Obesity is not just about weight. It is about inflammation, hormones, and insulin resistance. Visceral fat can push your body towards diabetes, even when labs still look okay. But it's reversible with the right plan and the right technique. This is what we do here at Dr. Nony's Power Lab. Turn complex health science into action steps you can actually use. If this opened your eyes, please like this video, subscribe for more deep dive on how your body works, and comment below what has worked for you in managing weight or insulin resistance. Let's stay strong, stay informed, and beat diabetes before it beats us. Thank you and have a great day. Bye-bye.